Hi, my name is Terry Tang, and this is my setup for vaccination Oscar. I have the insulated vaccine bag here with the vaccine inside, and I also have the hand sanitizers, sharp containers, and this is the documentations. This is the fake muscles. I have the syringe and the needle ready, and also this is the alcohol pad. I have the cotton, and I also have the anaphylaxis kit, and this is the garbage bag. Thank you very much. Hi, my name is Terry Tan, and I'm the nursing student from Medicine High that gonna give you the vaccination today. So, how are you feeling today?
I'm good. How are you?
Pretty good. So before we start, may I confirm your name and date of birth first?
Yep, Kushwinder Kaur, December 29, 1997.
Perfect. So may I ask you, have you received the current season of the influenza vaccine as like October 2024?
No.
Perfect. Do you live, work, or study in Alberta?
Yes, I live in Alberta.
Perfect. So before we start, I have several questions for you just to make sure that your body is ready for the vaccinations. Do you feel well today?
Yes.
Do you have any allergies before?
No.
Okay. Have you had any reactions to the vaccine before?
No.
Okay. Do you have any health condition that require a doctor visit or will require doctor visit in the future?
No.
Okay. Do you have? Are you taking any medications regularly?
No, I'm not.
Are you pregnant?
No.
Perfect. So I would like to review the influenza and the vaccine that I'm giving to you first. So just make sure that you're familiar with what we are giving to you. So influenza is a disease that is infections of the nose, throat, and the lungs that is caused by a virus. And immunization plays a pretty important role in fighting the influenza. So like by giving the vaccine, so it's actually helping you build up, helping you strengthen your immune system by building up the antibodies. So immunization is pretty safe, and it's always much better to get immunized instead of getting a disease later. So the vaccine that I'm giving to you is the 2024-25 influenza vaccine called Fluzone. So it is like 0.5 milliliters amount of the vaccines, and it is also considered a quadrivalent inactivated influenza vaccine, which means that it contains 4 strains, 2A and 2Bs. A's are Victoria, Thailand. B's are Phuket and Austria. So you may, after you receiving the vaccines, you may feel like some side effect, and those side effects are pretty mild, and then it can go away just within few days. So you may feel like fatigue, headache, and also you may feel like redness, swelling at your the injection spot, and you can feel like fatigue, headache, and also you may have poor appetite, nausea, and also stomach ache, vomiting, diarrhea. All those are the possible side effects for you. So if you experience any of these side effects, there could be several ways for you to kind of feel better. So you can always place a cool compressor on your injection spot, and also you can move your arm more frequently, so it actually can help absorb the vaccines. And also we would recommend you to take more to wear few layers of clothing and to drink more water, just to keep yourself hydrated in case of any fever.
Mm-hmm.
So if you have any further questions about the vaccines or the side effect, we always recommend you to go to myhealth.alberta.ca. You can get more information about it. And also, if you've noticed any unusual reactions after getting the vaccines, we would recommend you to call 811 immediately, so that we can help out and just make sure that it's not any severe side effect to you. And also before we started, and I would like to ask you, and also the vaccine is actually given to your deltoid muscle, so which is here. And so may I ask you, are you left-handed or right-handed?
I'm left-handed, so I'm gonna get it on the right.
Okay, sounds good. I'm gonna give it to your right arm. Okay. So before we start, do you have any questions about the vaccines, the disease?
No, I do not.
Perfect. May I have your consent about getting the vaccine?
Yes.
Perfect. So before we start, I'm gonna, oh yeah, and also we would recommend you for like to stay here for additional like 15 minutes after you get in the vaccine, because just want to make sure that you are ready, you don't have any severe side effect, so and or like allergies, so that we can keep track on you. Okay, sounds good. So before we start, let me just get prepared for my vaccination. Okay. Okay. Just do a quick hand hygiene. And I'm just gonna remove the vaccine from the insulated vaccine bag, and just checking. This is the right vaccine that I'm giving you, and this is not expired and it's pretty clean inside. So this is the vaccine I'm giving you, and it's not expired and it's really clean inside. Okay. So before, I'm gonna take the lot number down first. Perfect. And I'm gonna open the lid. I'm gonna agitate it. Okay, and also I'm gonna wipe, just disinfection. Yeah. And leave there for 10 seconds. So this is a syringe that I'm using, and this is the 25 gauge needle and 1-inch needle. Yeah. So this is the right one. Just gonna remove the safety, and also I'm gonna withdraw 0.5 milliliters of air. Yeah. And I'm gonna insert the needles into the valve and push the air into the valve. Just gonna withdraw 0.5 milliliters of the medications. Make sure that there's no bubble inside. Okay. Okay, perfect. Okay. I'm just gonna safely recap the needle, and I'm gonna do one more recheck. Yeah, this is the right one, and I'm putting back the vaccines. Okay. So before I start landmarking, I'm gonna do one more hand hygiene. Thank you.
You're welcome.
Okay. So this is your acromion process, and I'm touching the muscle here, and I can feel the muscle tail is right here. So I'm gonna do the injection at like 3 to 4 fingers below your process. Okay. So I'm gonna do the injections here. Okay. Thank you. First, I'm gonna disinfect your skin. Just make sure that it's pretty clean. Okay, perfect. Okay. So I'm gonna hold the cotton here. I'm gonna press this firmly. Just try, yeah. And I'm gonna remove the cap. Okay. I'm gonna press firmly, and then I'm gonna insert it into the muscle. There's no blood inside, okay? So I'm gonna gently push the medication into your muscle. Thank you. And just gonna do can you hold the cotton for me? And I'm just gonna do the recap. Just make sure that it's safely disposed. I'm doing one more hand hygiene. Perfect. So we would advise you to stay here at the facility for 15 more minutes. Just make sure that there's no unusual or allergic reaction happen to you. So while you are waiting, I'm just gonna do my documentation, and once I finish the document, you can just free to go home and take it home. So do you have any questions about the vaccinations or about me or like anything else?
I'm good. Thank you.
Thank you very much and have a great day.
Thank you, you too.
Thank you.